more common. Over the line.
Good evening, and thank you for joining us. We have another great show for you. We have Dr. Randy Smart, and he's going to talk about ulcers, right?
Stomach ulcers, John. Yep.
So not just generic. We're narrowing it down to stomach.
The stomach, right?
Yes. So is it really is what eats you? Is it it's.
I have some very good news for the viewers and for you. This is really good news.
All right.
This is a disease that you don't have to lose weight for. Like every other disease we've talked about, you had to lose weight.
Right.
That's pretty cool,
sure.
Right? And this is a disease that's getting better.
Easier to manage? Is it easier?
Less of it. Less of it.
Interesting.
So when's the last time we talked about a disease that's not getting worse?
What do you think a reason for that is? Why do you think we're seeing less of it over time?
I think a couple reasons. One of the things that provokes stomach ulcers is smoking, tobacco.
Got it. So we have less chronic irritants type of thing?
Yeah, exactly. And two is there are much better treatments now, almost kind of preventative treatments. So somebody that might have the startup symptoms, not sure, they do the preventative treatment. They never really form a full ulcer and never get into trouble. So a couple good reasons for that.
Yeah.
And it's not to say that it's not a problem anymore. It's definitely a problem. And you know, even at our county hospital here at the Mark Twain Medical Center, we see ulcers probably every month, I would say. But yeah, you don't have to lose weight, and it's not getting worse.
A question though, as a doctor, sometimes can it be the canary in the coal mine that's a indicator of something more serious or something? I mean, do you see it that way times or no?
Well, the medical community, the doctors, always when they see a problem, they always say, well, it could be this. I mean, that's the way we're trained. That's the way we think. So stomach ulcers can be stomach cancer. So we know that, and we think about that. And it can be associated with other diseases. People who become seriously sick can develop ulcers kind of as a result of that stress of being sick. So yeah, we always have that in the back of our mind. But, you know, what's really cool to me is some 30 years ago when I was in training, we thought all ulcers were caused by stress. I'm talking about the 1980s. You know, I'm not talking about like 1800s. You know, and we thought and we saw a lot of them. I mean, bleeding, throwing up, you know, operations, and actually, stress is still on the list, but it's kind of a minor part. It's not a very big part of this. But and to take it even a step further, if you were to go back to the 1940s, 1950s, like some of the treatments for stomach ulcers are things you would be amazed at. Like they thought your dental hygiene was related to stomach ulcers.
Got it.
So one of the treatments for ulcers were to take out all your teeth. And they would do that. I've known people that went through that time and so
taking a Prilosec or two is easier than
taking out all your teeth. Exactly. So yeah, it's been quite the evolution of understanding and treatment. We know a lot today. There's probably still a lot we don't know, but it is really it's been one of these. I mean, it's almost like tuberculosis, which was consumption. And back in the 30s, 20s, 30s, 40s, man, it was a problem. Everybody got it.
You had
It
whole
was-
institutions that were just TB.
Yes.
TB
yep,
farms.
TB only,
Yeah.
yeah. And you don't see much TB
Right.
anymore in this kind of environment, this kind of community. And ulcers are kind of the same way. It used to be this big deal. Everybody had them. You know, they were getting their teeth taken out. They were, you know, doing all this other stuff. And we've kind of got a little bit of a handle on it now.
Very cool.
I think that's pretty neat.
Yeah. Yeah. So, you know, even if somebody does have some stomach issues, typically you got the magic bullets now that can get it knocked down, huh?
Much, much better.
Yeah.
We used to use a medicine that many of the viewers will recognize called Tagamet.
Mm-hmm.
It was also called cimetidine. And we still use Tagamet and cimetidine today, but it used to be that was all we had. And we were just dumping buckets of Tagamet down people, you know, just more. And they'd say, I can't, and more Tagamet. And it's, gosh, probably 4th or 5th line therapy now.
Right.
I mean,
Right.
it's not even something you think about a lot.
Yeah.
But you know, one of the most, I think, impressive things about ulcers in the last 30, 40 years was the fact that ultimately we found out that a lot of them, maybe even most of them, are caused by infection.
Interesting.
And we didn't know that.
Right.
We had no
Right.
idea. We thought it was stress. We thought it was bad dentition, maybe the cigarettes, but nobody thought infection. And then right around 1989, 1990, some very smart people said, wait a minute, what is this certain bacteria in there? What is this thing? And is that related? And should we treat it? And will that make these people better? Just brilliant work, absolutely brilliant
So
work.
you treat that in the end, and it fixes it, it just goes away.
Kind of,
Yeah.
yeah, kind of. Yeah,
Yeah.
so the infection is a bacteria. Now, let me back up a little bit. About 40% of stomach ulcers are from this infection. That's a big percentage. And about 40% are from something we'll talk about soon called nonsteroidal medicines, which are anti-inflammatory medicines.
Right.
And then there's 20% that are just from weird things.
So like aspirin or something like that, that's an irritant.
That's a nonsteroidal,
Okay.
yeah.
Okay. Yeah.
So to get back to your question, can you just treat it and it'll go away? Absolutely. So the bacteria infection is called Helicobacter pylori,
Right.
and it used to be called Campylobacter pylori. They renamed it Helicobacter pylori. We abbreviate it, call it H. pylori. And H. pylori is kind of the causative problem with a lot of these ulcers. Now, H. pylori alone won't cause ulcers. It takes a little more than that. It takes maybe a certain genetic makeup,
Okay.
or maybe another thing you're doing on top of that, like maybe
Yeah.
alcohol or tobacco.
Mhm.
But the thing is, if you find that H. pylori, and I can think of 3 different ways to find it, maybe 4. If you find that H. pylori and you treat it, the ulcer goes away, the ulcer heals, it doesn't come back, life is great. You don't need an operation.
Right.
Yeah, so pretty cool stuff.
Is some of that related to now? It seems like a lot of the buzzwords is on the health community is, you know, is maintaining your gut environment, you know, your gut
Your
bacteria.
microbiome.
Yeah, your microbiome. Is
Yes.
that all part of the same deal, or is it?
I don't know. I know there is a ton of interest in what's in your colon.
Right.
And,
Right.
and to some extent your small intestine, but mainly your colon. And there are actually more bacterial cells in you than there are human cells in you. And those bacterial cells are now known to be a benefit in terms of excluding other more harmful organisms, in terms of modulating immunity. They now know that certain organisms help you fight off other diseases. They don't know exactly how they do that, probably by secreting certain proteins
Sure.
that are beneficial for both me and them. But that's when we talk about the microbiome, we kind of mean the flora of the mouth, the flora of the gut, probably the skin. I mean, there's lots of bacteria on your skin, staph.
Sure. Yeah.
But your stomach is a little bit different. For example, your stomach is this very acidic environment. So acid is measured on a scale called pH. And the lower that number, the more acidic, and the higher the number, the less acidic. And it goes from about 1 to 10. So 3, 2, 1 is pretty acidic, and 9, 10, 11 is not, 8, 9, 10. 7 is where life is happy, 7.4 to be exactly. So your body is 7.4, your blood is 7.4. Well, your stomach has a pH of about 1. And that is called hydrochloric acid.
It just wants to eat stuff.
Oh, man.
Yeah.
And so your stomach, it's just amazing to me that this happens. Your stomach secretes hydrochloric acid, makes hydrochloric acid, secretes it. And that hyperacidity is part of the equation for causing ulcers. But the fact that, I mean, hydrochloric acid, like if you've seen like a horror movie.
Oh, yeah.
And the guy drips acid on something and the smoke comes up,
Yeah.
that's what it is. I mean, it's super caustic and destructive. But your stomach tolerates that. It tolerates this super acidic environment, usually.
Yeah.
But if you add H. pylori to it or an NSAID or a couple other things, then you create an ulcer. But because it's a super acidic environment, there aren't a lot of organisms that live there.
Got it.
It's not part of the microbiome
Got it.
necessarily. But H. pylori can live there, and it does live there. And it lives at the distal end of the stomach, a part of the stomach we call the antrum. And I don't actually understand the pathophysiology of how H. pylori creates an ulcer. But basically what we do when we're looking for an ulcer now, we put a scope down into somebody, we go into their stomach, we find the ulcer, and we nip off little pieces, and we can test that for H. pylori sort of at the time we're doing the scope.
Yeah.
We put it in a little dish, and we add
Yeah.
a couple of reagents, and it turns pink, and you say, yeah, they got it. Yeah. And treating that then cures that ulcer.
Wow.
Which, I mean, 30 years ago,
Yeah.
you got all your teeth yanked out.
Right.
So that's been just a huge thing for us. The treatment for H. pylori is not so easy. It is a combination of 4 drugs for 2 weeks.
Oh, wow.
There's not a lot of infections where you take 3 or 4 drugs at a time.
So you really have to nuke it.
Yeah, you do.
Yeah.
I mean, there are some, like TB is an example of one where you need multiple medications, some of the more complicated bacterial infections. But most bacterial infections, you take 1 antibiotic and it goes away.
Right.
And one of them, actually, interesting, is Pepto, is bismuth. You know, the pink bottle with the, that's one of
So
the.
that's one of the.
That's one of them, yeah.
So we were almost there 30 or 40 years ago.
Yeah,
right? We
you
were
know,
almost
right,
there, but
right.
just not quite.
Right.
Yeah.
And then you mentioned the other that has been just a huge breakthrough with stomach ulcers is Prilosec. So Prilosec, which was the first of that class of medicines, came out about the same time, about 1989, 1990. Real game changer. What Prilosec does is it prevents your stomach from producing acid. That's how it works.
So it gives the whole system a break while you're on that cycle of it.
It changes that pH from 1 to about 5 or 6.
Let stuff repair.
And everything tends to improve. So Prilosec is over the counter, right? You can buy it over the counter, any drugstore. And that Prilosec has been a huge breakthrough because 1, you have to figure out what's causing the ulcer. But then 2, part of the treatment is to make it a less acidic environment, which you do with Prilosec. Right. And then you add the bismuth, the Pepto, and then you add a couple antibiotics, 2 or 3 antibiotics, and 2 weeks later you're good.
Yeah.
You're good to go.
Yeah. Huh. Interesting.
Yeah.
So basically, it frees up your time to treat other illnesses rather than, because, I mean, ulcers, that used to be as far as family medicine, that was a pretty mean, that was a chunk, wasn't it?
That was
I
a
mean,
big
yeah.
deal, big deal. And if you think about the morbidity involved, so an ulcer, one of the most important complications is bleeding.
Yeah.
So your stomach is very vascular.
Yeah.
Because of, it's eating things, so it's very vascular. So when that ulcer erodes into those arteries and veins, you can really bleed. You can die. I mean, you can, and unfortunately, some patients, the first sign they have of any problem is the bleeding.
Right.
They won't have the pain.
Right.
They may not even have the nausea. They may not have any other symptom, but suddenly they poop out a big black thing and they're already in trouble.
Now, is that kind of related? Because it seems like years ago, we used to always talk about people being anemic. I mean, was that part of the, hat in hand type of stuff from just a lot of the ulcers and, chronic bleeds and stuff like that? I know,
Yeah.
you never really hear about anemia so much as, seems like as you used to, maybe not.
I think that was part of it. It definitely if you have a small ulcer that's kind of oozing,
Right.
You can definitely get anemic. But really the biggest causes of anemia are menstrual bleeding. A lot of the young women will have anemia.
Right.
And the other big cause of anemia is diet. And so vegans don't get enough iron. I know because I married one. and
Are you now, pretty much?
No,
You're not.
No,
Oh, okay.
no,
So you've managed that whole.
That was part of the agreement. We never eat the same meal. Actually, never do. But boy, is it hard to find food in the house. Oh my gosh. There's leaves and
Yes. Snacking's a whole
branches
different thing.
and mushrooms and all this stuff, and you go, man, where's the protein?
Where's the? Right.
I need some protein.
Yeah.
Yeah. But yeah, so the vegans would not get enough iron, and they would get anemic. And if you had menstrual periods to a vegan diet, and there's a lot of vegans these days, iron deficiency anemia is pretty common.
Pretty common.
Yeah. But you can get it from ulcers.
Yeah.
Now the other big cause of ulcers were NSAIDs. And it used to be that there were not a lot of NSAIDs. NSAID is like aspirin, Aleve, Advil. A point of fact is that Tylenol is not an NSAID, so Tylenol isn't what we're talking about. But all these other NSAIDs, really, they didn't come on the market until, the 70s, even a little bit in the 60s. I think ibuprofen in the 60s, and then the 70s, and there's probably 20 of them now. But these NSAIDs are particularly a problem with stomachs in certain people, not in everybody. And so people that take Aleve or Advil, which are great medicines for great reasons, can actually burn a hole in their stomach. And so that is the other big thing. One was the infection, the other is the NSAIDs. So we try to be pretty careful with NSAIDs. I mean, they work really well with joint pain and headaches and just a variety of things. But we're always kind of saying, not too much.
Don't make it part of your daily regimen.
Not too
only
often.
As needed,
Exactly.
2 of them every day type of thing as part of your routine. Huh?
Yeah, exactly. So there was a guy named was it Frank Nutter? No, maybe it was Norman Rockwell. No, it was Frank Nutter, I think. He would draw pictures of the perfect heart attack, and it was the middle-aged male coming out of the restaurant with a cigarette hanging out of his mouth in the cold weather and the snow, and holding his chest, and you go, okay, that's a heart attack. I don't know it's just a visual, but that. So if you were to do that about ulcers, it would be a male. They're more common in males who is smoking a cigarette with a drink in his hand, popping a couple Motrin for the headache he's going to get the next morning, so he can go to work. And kind of the perfect storm. You burn a hole in your stomach.
Yeah.
Now the other big complication from ulcers, one is bleeding, and bleeding is a big deal. because it can be arterial bleeding and it can be definitely an emergency. The way somebody would know that is they would have black stool.
Right.
And it has a very distinct smell, and it has a little bit of red in it. Just as a side note, if somebody takes Pepto also causes black stool. So you can get fooled. But basically that's what somebody would notice if they're bleeding. But the other complication is perforation. So your stomach actually is pretty thick. It's probably 3/8 of an inch thick. And you can burn a hole through that doing this. And when you do, that's called perforation. And suddenly you have gastric juice all over and you have infection.
Then you go down the whole sepsis route, right?
You're in trouble, right? You are in big trouble, right? And so basically somebody has perforation, goes right to the operating room. I mean, they stop in the ER, we take the film, we see they're perforated, they go right to the operating room,
Because isn't that, I mean, because once that goes through and they start getting into like sepsis, I mean, it's just multi-organ failure. I mean, once you have to knock that, you have to nuke it quick, right?
It's all hands on deck.
Right.
Because they are in trouble. And
Yeah.
if you were to ignore a perforation, you would probably see death at about 36, maybe 48 hours.
They got a couple days.
Yeah, it depends on the reserve. If they're healthy like you, they got a couple days. If they're a little bit older, a little more frail, man, it's like the perfect storm, just boom, and they go downhill. So we don't see that as much as we used to. We still see perforations and we still go to the operating room. But we see bleeding all the time. We used to see these perforations all the time. So I guess one of the messages we could get out to the viewers is if you have stomach pains, which can be one of the presenting symptoms, you should get that checked out. And if you're on NSAIDs like Motrin or Aleve, Advil, you should probably stop those until you get it figured out.
Yeah.
And some Prilosec is probably a good idea. So there's a couple things you can do. You know, if it's a Saturday or Sunday and you're waiting till Monday, there's a couple things you can
Start
do.
your Prilosec cycle.
Get off the Aleve and Advil, start the Prilosec. Yeah, exactly. Yeah.
And it kind of spin is a little bit of a positive angle is because you're talking about one medical condition that we haven't eradicated it, but we've turned it into a manageable and declining in numbers. Are we just, in a weird way, I know all the talk about health and everything else, but are people generally getting healthier now? I mean, are we making progress as a society overall? And sometimes we take that for granted, or no? We're not.
So we're doing better with cigarettes.
Okay.
Which was huge. We're doing better somewhat with alcohol, but we're really having challenges is with weight. And we're seeing.
So weight is overcompensating for all the things,
It's offsetting the rest, And we've made huge advances with cancer.
Right.
I mean, it used to be cancer was a death sentence. It didn't even matter what kind. If you have cancer, go get a will. It was one-stop shopping. That's all you needed. But cancer, like with breast cancer now, 90+% survival. Prostate cancer, 90+% survival. Some of the leukemias, 100% survival, 90% survival.
They're more chronic things now rather than acute, right? I mean, you just manageable or.
There's a lot you can do. Yeah, there's a lot you can do. So a lot of medical progress, but honestly, if I had to raise the red flag, it would be with the food industry. And I'll probably be marked after this show. but the food industry is just not honest. They're just not.
Right.
And they are happy when you eat a lot. They are, I think, not honest about what they put in foods. I think labeling is misleading. The high fructose corn syrup, the sugar, the processed food, and they know how to make you eat more.
They know how to make it addicting.
They're very good at that.
Yeah.
Yeah, they know how to. And then you add on top of that the fast food industry. man, not a good thing. But it's so convenient, right?
Sure.
You know, you pull
Yeah.
into the thing, you got a couple burgers, tastes good, you're having a busy, you earned it. You're having a
Yes.
busy day, right?
Yes.
So the fast food industry doesn't help. And then the restaurants, oh my gosh. I mean, mounds of food.
Right. Right.
You know, I don't know anybody that can eat the amount of food on a plate at a
Yeah.
restaurant.
Yeah.
I mean, you just look at it and you go, whoa, is that for everybody or just me? You know, and I mean, so if I could raise the red flag in healthcare, it would be directed more toward obesity, the food industry.
I saw something that was kind of crazy. I wish I could remember where I read it, but the whole gist of this story was that you would be surprised how many people that routinely eat 5,000 and 6,000 calories a day every single day. You know, I mean, it's not just, you know, it's not the, I mean, the sheer volume of food. I mean, the sheer volume of just calories and stuff. And there's a lot of people that just eat.
And they make it so easy.
Oh, yeah.
They make it
Yeah.
easy. I mean, you can order your groceries on the phone. They'll bring them to the car. I know it's a little more complicated than that, but you know, you can pull into the burger shop on the way back from lunch. I mean, they just make it too easy.
Yeah.
I mean, the food industry is not serving our community very well.
Right.
I mean, they're just not. By the way, people always, getting back to ulcers, you know, stomach ulcers, people always wonder, what about diet?
Yes.
You know, we talked a little bit about the vegan diet, but that wasn't in this context. And so there really isn't a specific diet for ulcers. One of the few topics we've talked about where it probably doesn't matter what you eat.
Got it. So,
Yeah.
I mean, even maybe would something like an intermittent fasting help, where you just basically you don't give the stomach anything to work on for a while? Does that help or no?
Probably no.
Wow. Okay.
But they've done experiments where they have people with ulcers, and like one group is eating jalapenos,
Right.
and the other
Right.
group is eating like rainbow bread or
Sure.
something.
Yeah.
And it just doesn't seem to make any difference. I mean, it does turn out that the diets that have more vegetables and more fruit, those patients tend to have fewer ulcers.
Fewer ulcers.
Yeah. But if you were to have an ulcer right now and you were to say, "Hey, Randy, what should I eat?"
Sure.
I'd say, "Eat anything you want."
Anything you want.
Yeah. I mean, there isn't one that's better than the other.
So the peppers don't kill H. pylori.
Not so far.
No, they don't.
No, not so far. Right.
So you don't. If there's a strong enough pepper, it doesn't. It
right.
doesn't kill the.
We haven't found the pepper
Okay.
yet. Yeah.
All right. We got about a minute left. So what's the summation on ulcers?
So if you're having stomach pains,
Yeah.
think ulcers. They're provoked by smoking. They are provoked by alcohol. They are made worse by NSAIDs, Aleve, Advil, not Tylenol. Tylenol's fine. They're preventable, and if you don't treat them, the complications can be life-threatening.
Yes.
Yeah,
Yeah.
that's what I would say.
Thank you, doctor. Appreciate it. Thank
It's
you.
a pleasure, John. Thank you.